Oh, 5 minutes. Dr. JK, will it be possible? Oh, great. That's fantastic.
Yes. Yeah, switching on the taking. It's a punctal occlusion procedures. There is a confusion. Always you call it as punctal occlusion. It's nothing like punctal occlusion. There are two types here. There is a punctum, there is a canal class. So there is a punctum occlusion, canal class. We have to improve. You cannot keep on studying the books and keep on doing that. So every day you have to improve. Every day. It's not. It doesn't end with the books. Okay. So there is a, you put something in the punctum, it's called punctum. If you put in the canal class, it's called canal class procedure. So this is a punctal and canal class as they're telling. So what we do is in canal class, we put collagen or catgut. Collagen you can buy, but it's not freely available. You can just buy 20 catgut or 30 catgut, plain or chromic, whatever. Just 10 rupees, is 100 rupees you spend, it comes for your lifetime. Put it in the alcohol, cut into 4 millimeters and put it in the canal class, not in the punctum. Okay, this is for done for a the technique I will show you. In slit lamp you can do it. Slit lamp we can do in the lower punctum. We cannot do in the upper punctum with the slit lamp. So slit lamp we can put anesthetic drops and put it in the this 4 mm length. This one, this is for dry eye, for temporary relief for dry eye, or whatever procedures like keratitis medicamentosa or whatever maybe. They might have used a lot of antibiotics unnecessarily, quinolones, they produces exaggerates the dry eye. Then you have to push it. Here I will show you. This we are putting in the right eye. So now you put in the punctum. Okay. Then you leave it. It will be like that. It will irritate the cornea. It will make the patient worse. So we have to push that into the canal class. You have to straighten it, pull the lid. Then the punctum will become straightened with the canal class. Then push it and it should disappear. Then it is the canal class. A chromic catgut will swell and last for more than 1 month. So which condition you do it is post-operatively patient comes like that. SPK, they put on antiviral. No, it's not antiviral. Is not this is called keratitis medicamentosa, keratinized corneal epithelium. So you have to cure that. You have to stop the quinolones. Put on no need for any antibiotic. Put canal plugs and put the artificial tears and oral vitamins. It will cure. Then the other one. This is the punctal plugs. You see here, it's nicely sitting punctal plugs. These are just mostly like a symptomatic patient with no disease. No disease. The symptomatic patients you can use them. So they usually get a granuloma. You get infection, granuloma. These are silicon plugs. Silicon attracts bacteria. Silicon is a rough surface. So it attracts bacteria, it attracts mucus. Silicon is not ideal material to put on the external surface. You can see a granuloma here. So this is not for they call textbook as a permanent procedures. They are not permanent. They are very bad materials. So then comes the punctal occlusion, permanent. We want to do permanent, like rheumatoid arthritis, Sjogren's, where streamers is less than 5 to 10 millimeters. I do one punctum. More than less than 4 millimeters, I do both punctum. So how do we do is you just take your bipolar cautery, connect one lead to the needle and one lead to the speculum. Whatever you are putting the speculum, and this is canal class come punctum cautery. You are passing into the canal class and cauterizing both canal class and the punctum. If you want temporary one, you can just put on the punctum a cautery that will last for few months, then it will open up. So this is the upper punctum we are doing. So then you use that with a low, don't use very high power, use in the lowest power possible. Wait for the tissue becomes white blanch, then come out with a needle. So this is the post-operative results. You can see a nice punctum here. Here is completely closed. And whichever the cases, you got a Dellen in a rheumatoid arthritis or a Sjogren's, you got a Dellen, you have to do a definite procedure. You have to close the punctum. Don't put punctum plugs. You put a silicon plug, it will rub, that will become worse. And Vinay, I think he got a lot of experience removing the punctum plugs and cauterizing, patient improving within 24 hours. He got a beautiful slides within 24. With the punctum plug, nothing happens. With cauterization, 24 hours patient improves. So when you see a definitive disease, then do cauterization. Don't put punctum plugs. And this is the other eye of the same patient. We did only lower punctum. We didn't do upper punctum because there is no corneal disease, and we expect that patient is going to get the same Dellen in the other eye after some time. So we want to treat that. So So you take a decision before you go for treatment. Don't tell the treatment, I do lower punctum, it doesn't work. I will do upper punctum, the patient will lose confidence. You have to take a decision. When there is a dull line, then okay, go ahead and do punctum. If there is no dull line, just a little bit SPK and fluorescence staining or little filament, then do a lower punctum. Thank you very much.
Thank you, sir. Thank you for that concise and wonderful talk.